really appreciated your views on free market solutions to healthcare problems. And right now, the #1 driver of healthcare costs has been chronic disease, and Americans younger and younger are suffering from more common chronic diseases. I was wondering if you think the free market can address that to stop, rein in these escalating chronic disease costs.
Sure, the free market does a better job of that than anything else. America has done a better job with serious illnesses than any other medical system in the world, because we are a free market, because people can purchase insurance. Insurance can cover risk. The more you would have private insurance, the lower the cost would go, and the higher the quality would go. The more you go in the direction of government insurance, it becomes much more expensive and it starts to cover less. Now, why is that? Because you don't end up sharing the risk appropriately, and you have no principle that reduces costs. How is it that people that couldn't afford high technology items, who are relatively poor, how is it that they can now afford it? How does that happen? It doesn't happen because the government subsidizes the purchase. It doesn't happen because the government controls the price. It happens because other people buy it. So a new item comes out. Remember that iPod that came out about 2 months ago? The magic iPod, it does everything. You can talk on the telephone. You can listen to music. You can download music. Pretty soon you're going to be able to watch television on it, which I'm looking forward to that one, because then I can see Yankee games. And you can watch Red Sox games. I think they're playing right now. Just to show you how I keep up with this, I think the Red Sox are playing a doubleheader today, right? And they're playing right. They may be playing at 9 in the morning or something. So you can watch it noontime, right? The noon game, right? It's going to be I love those games. Yeah, those are the best games, daytime games during the week. You could be watching it on television instead of listening to me. And I was with a friend of mine who has two teenage children. One of them bought the iPod the first day, and the other one didn't. The one who didn't is the one who's going to become a millionaire, because the one who didn't said, "I'm going to wait 4 or 5 months, and that thing's going to cost less in 4 or 5 months." And why does that happen? It happens because a market operates to drive the price down. We've got to get that working in health insurance. We've got to have 40, 50 million Americans out there buying their own health insurance. How old are you? You should stop buying health insurance right now. I'll tell you why. You'd get it real cheap. You're young, strong, good shape, I bet. Okay, you'd get it real cheap. But what you should be able to do is develop equity in it over a lifetime. So when you're really going to need it, maybe, God forbid, that our advanced age, right? You'll have a lot of equity built up in it. And then if you don't need it, you'll have a lot of equity anyway. The way that happens with life insurance. But health insurance isn't like insurance. It's like an entitlement program. So that's the way it would help. And then just to give a comparative analysis. I know when you have town halls and when you have political campaigns and you have political candidates, there's a real emphasis to focus on the negative. All the things that are wrong, how you'd solve them. All the things that are wrong, how you'd solve them. And then somehow the news happens that way too. Every night it's everything that goes wrong. You hear about it. You don't hear about everything that goes right. So somehow you have to have a little perspective on this. American health care, the core of it, is the only way it can work, which means private. I had prostate cancer 6 years ago. My chance of survival of prostate cancer in the United States is 82%. If I were in England, my chance would be 44%. Which one do you prefer? You want socialized medicine, Democrats are going to give it to you. I mean, that's where they're going. I know they don't like to say that, but that's where Barack Obama is going. That's where Hillary Clinton is going. That's where John Edwards, I think, already is. I mean, he wants to cover everybody on Medicaid. That's social. I know there are euphemisms for this, but it's socialized medicine. It's government controlled of a lot more of medicine. And I think you're going to see, as you have in the socialized medicine, a real deterioration of health care. And one of the things for sure you're going to see is an inability to deal with chronic illness and long-term illness and serious illness. Because one of the areas in which we really outperform most of the rest of the world is in some of the most serious illnesses. We deal with cancer better. We deal with heart better. Because we have the ability to pool our risk.